The Wall of Names memorializes our nation's heroes who died in the Vietnam War. More than 1,300 of those listed have been identified as medics. Brave Americans who gave their lives while answering the desperate call of injured comrades. A call that has sounded down through history when Americans have marched into battle.
Medic! Medic, over here!
Coming! Coming! This way! Medic! Medic!
Doc, tag him and bag him.
While the profession of medic has its roots in battles as far back as those at Washington, it was perhaps in Vietnam that it reached full maturity as a standalone profession. Medics with training and skills unequaled in previous conflicts proved themselves under fire in Vietnam, then returned home to use that skill and training to lay the foundation of out-of-hospital emergency medical care as we know it today. A major step in the evolution from rudimentary litter bearer in the times of Washington to medic occurred in the Civil War. The number of casualties in the Battle of Manassas was horrendous. It took an entire week to remove the wounded from the bloody battlefield. Dr. Jonathan Letterman, head of the medical services of the Army of the Potomac, realized the urgent need for an organized system of treatment and evacuation. Soldiers aboard horse-drawn ambulances of both the Union and the Confederacy, braving enemy fire to care for their comrades, were the true forerunners of today's medics. In World War I, the evolution continued. The U.S. Army Ambulance Service was created. Again, the responsibility, fulfilled with courage and compassion, was essentially the removal of the wounded from the battlefield. They often did more than was demanded. In World War II, the role of the medic changed. When the call went out, the frontline combat medic leaped from the foxhole and raced into the ferocity of bloody war. He had the training to examine and assess injuries, apply tourniquets when needed, administer a pain reliever, clean the wound, and perhaps apply the newly developed sulfa drug. Then he dragged the victim to safety behind the lines. The enemy did not always respect the Red Cross emblem he wore, and often he worked with shells bursting around him. In many cases, the respect for them became so strong they were summoned to their duty by wounded soldiers crying out, "Doc," instead of medic. The Korean War saw the first use of helicopters and introduced mobile Army surgical hospitals, the MASH units. The training and skills of the medics continued to advance. When the American military entered Vietnam, it brought to that battleground medics with training far beyond that of other wars. They were taught to give shots, draw blood, start IVs, apply splints, and to treat gunshot wounds, head wounds, and amputations. They were trained to treat shock and burns, to administer CPR, perform tracheotomies, and suture wounds. All this and more they were taught to do under combat conditions. For the first time, medics carried firearms and grenades. There were no more red crosses on their uniforms. When earlier wars ended, medics returned home to pursue other occupations. The Vietnam medics, however, returned to a nation awakening to the need for their skills on the civilian scene.
In 1966, the American College of Emergency Physicians had released a study on accidental death and disability. The study revealed that Americans had a better chance of survival in a combat zone of Vietnam than on the average city street.
Out-of-hospital emergency medical care consisted of ambulance transportation provided by drivers with little training, using inadequate equipment. The service was almost as primitive as the era of the wartime litter bearers. The ambulance industry had no regulations.
In 1971, the federal government finally imposed stringent regulations on ambulance services. The funeral homes that had operated ambulances as an unprofitable sideline left the field. A new era in emergency medical care was being born, and in community after community, those who had served as medics in Vietnam stepped forward to provide the professional skills essential to its development. They also brought with them a legacy of honor, courage, and compassion.
The rest is history. Born in the horrors of war, the profession of medic grew as technology and training advanced, becoming as vital to the civilian world as to the world of battle. With incredibly advanced life-saving skills, today's medic is a recognized professional. It is a noble profession.
Surprisingly, the steady advance of the profession has created a problem of identity. The certification of different levels of skill has resulted in new designations. Emergency medical technician, EMT basic, EMT intermediate, EMT paramedic. Use of the different categories does not give a clear impression of the fact that all are part of the same proud profession working at different levels. Old terms that are no longer applicable have not been erased. Emergency medical service workers, ambulance attendants, even ambulance drivers are terms that persist in the media and are used by public officials.
The American Ambulance Association is campaigning to remove the confusion that surrounds the profession by urging public officials, the media, and the general public to use the historic, time-honored term medic to describe all certified professionals who provide out-of-hospital emergency and non-emergency medical care and transportation.
The realization of the identity problem and the determination to eliminate it came after the 9/11 terrorist attack. Well-deserved tribute was paid to the firemen and policemen, but even in the speeches of the President of the United States, the 11 medics who died in the New York tragedy have gone unmentioned. We do not believe anyone intentionally slights the courageous action of the medics at the scene, but it is likely that instead of being looked on as a group of heroes from the same field, they may have been listed separately under different designations.
Use of the single designation medic will eliminate confusion and clearly identify such heroes as members of the same dedicated profession. The goal of the Ambulance Association is to make the term medic synonymous with those who provide emergency and non-emergency medical care and transportation, just as firefighter and policeman are synonymous with the professionals in those fields.
There is, of course, more to the move than identity clarification. In using the term medic to encompass all within the EMS industry, the American Ambulance Association seeks to emphasize the courage, skill, and compassion that the name signifies, and the rich heritage of the past that the medics of today embrace and continue to build upon.